Yes, this middle-aged male patient or young age, 20-year-old male patient present with a palpitation. Yes, yesterday we saw him at the clinic. Yes, is a critical, good case, and this is a band inside the left ventricle. His ECG is this. Yes, this ECG was very interesting because initially we were confused. This is the ECG with very, very peculiar characteristic. Initially, the presence of R-wave MV1. Presence of R-wave MV1, right bundle branch block similar. And sometimes some irregularity inside this QRS complexes confused us. What is this? And it is little bit or relatively narrow. There's 140 millisecond. Here the presence of right bundle branch block and left axis deviation, because the QRS complex is positive here, up in lead 1 and negative in AVF. It is characteristic of BTAC and the presence of fusion beat. This is the fusion beat above, and this is the capture beat before the runs of VTAC, that is opposite of the normal sinus beat, and this is fusion beat. This also diagnostic of VTAC, and the presence of QS in V6 plus left axis deviation also diagnostic of VTAC, and retrograde conduction, there is an AV dissociation, also diagnostic of VTAC. But what is sort of VTAC? This is was the confused item. The ventricular tachycardia, this in young male patient, it is a fascicular VTAC that initiated. Suppose this is a left ventricle and this anterior fascicle, this is left posterior fascicle, this is left bundle branch, and this is right bundle branch. It is initiated here, the VTAC initiated from the left posterior fascicle and go up through the anterior fascicle and then making this and cause left axis deviation with right bundle branch block in V1. The positive R wave in V1 indicated the left ventricular origin with left axis deviation from the posterior fascicle. The VTAC that originated from anterior fascicle, it is caused right axis deviation and positive R wave in V1. This is called an idiopathic VTAC, which is confused with the WBW syndrome because the young patient, the young age, and the relative and structurally normal heart. Yes. The patient was treated with amiodarone infusion, but there is no response at all. Second day, we started him verapamil as a Bilhassen criteria, that is idiopathic left ventricular tachycardia originated from the left posterior fascicle, and he responded. This is the second ECG of the same patient. Look here, this is the first ECG, and this is the second ECG after 1 hour of treatment with amiodarone. There is no response at all. Yes. Look. And this is the strap. Yes. This is the third ECG. The same ECG also. Look carefully at the ECG. Yes. This is called verapamil sensitive ventricular tachycardia in structurally normal heart. This is, yes, and this is the fourth ECG with pause at the middle. This, the block because the amiodarone and at the early morning the patient is still not responding. The second day we will give him verapamil. The patient was returned to sinus rhythm. This is the sinus rhythm characteristic with relatively normal ECG, apart from inverted T wave in inferior leads, because he has inferior wall non-compaction, and he has also interventricular moderator band. But we didn't have what is the relationship of these structural changes with the Belhassen criteria, and this another ECG at sinus rhythm. Yes, it is a great chance to watch and to see this type of rare VTAC, but it's common. We saw another patient. This is another patient with the same VTAC. This is the positive RVF MV1 and negative QRS MV6 but the axis here was left extreme axis because the positive in ABR. This is the diagnostic of VTAC. Also, this patient is 25-year-old male patient. They brought him to clinic with the palpitation. Really, we was confused at that time. We were confused because we didn't able to determine what is the type of this VTAC. But the patient brought his treatment verapamil in his pocket. Yes, look here. This type of the VTAC is initiated near the septum, so that it is narrow. Yes, it is called fascicular VTAC, idiopathic left ventricular tachycardia. Thank you for your kind attention and kind listening.